Welcome to our webinar. We're happy that you could join us today. I hope it's not as gloomy where you are as it is by me. I'm in Chicago and it's raining pretty hard, but it's nice to see spring is finally here. Anyways, welcome to our webinar. Today we're going to be doing quality reporting using HQM. So I just want to let you know the process for today's webinar. First, I want to mention this webinar will be recorded, and we're going to send out recordings as well as a slide deck of this within the next week. Okay, so a bit of who we are. We're Attentive Healthcare Solutions. We specialize in NextGen healthcare. Our goal in life is to make delighted clients by helping them get the absolute most out of their NextGen software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen, and we have two NextGen add-on productivity solutions, ChartGuard and Refund Manager. Okay, I also wanted to draw your attention to our next webinar. Next week, so a week from today, we're going to be presenting NextGen Best Practices for HIPAA Security Risk Assessments. This webinar is going to focus specifically on HIPAA security risk assessments as they relate to NextGen. We're going to be sending out an invitation for that later today, so keep your eyes open for that, and we hope to see you there. Okay, so back to quality reporting using HQM. We're going to take questions at the end of the presentation, but you can type them in the questions area of the webinar control panel whenever they occur to you, and we're just going to answer them all at the end in the order that they come in. So our presenters for today are Lindsay Lanning. She is Healthcare Compliance Consultant at Attentive Healthcare Solutions, and Cindy Kincaid, who is VP of Consulting Services. So Lindsay, I'm going to go ahead and pass it off to you. Please feel free to get started when you're ready.
Perfect. Great. Thank you, Chelsea. Hi, everyone. Thank you for joining us today for our webinar, Quality Reporting Using HQM. So I want to start off by saying if you're coming into this call feeling at all overwhelmed by MACRA and its reporting requirements and you're not sure how you can track or submit your data to CMS, trust me, you're not alone. This new program means a lot of changes when it comes to quality reporting than what we were used to. So we at Attentive truly understand the complexities surrounding the new MACRA legislation, and we'll look at how eligible clinicians can use the NextGen HQM to report under MIPS or through your APM. So specifically in today's webinar, we will look at industry insights on MACRA, MIPS, and the Quality Payment Program. Everyone on this call most likely has varying degrees of knowledge on MACRA, so this will make sure we're all on the same page. I want to warn you, this won't be a deep dive into MACRA or its requirements. It will just provide you with what you need to know for the purpose of this webinar. We will then look at an overview of the HQM, highlighting specific features and functionality, and then really focus on HQM reports and MIPS reporting using the HQM. So let's get started with the basics. On October 14th, 2016, the Department of Health and Human Services issued its final rule implementing the Quality Payment Program that is a part of the Medicare Access and CHIP Reauthorization Act, or MACRA. It's a piece of bipartisan legislation that replaced the flawed SGR with a new approach to paying clinicians for the value and quality of care they provide. Now, what MACRA really did is establish the Quality Payment Program, or the QPP, and providers have two ways to participate in the QPP, either through an Advanced Alternative Payment Model, or APM, or through the Merit-Based Incentive Program, or MIPS. Now, in 2017, the majority of providers will be reporting under MIPS. So what is it? Well, the MIPS program combines existing quality reporting programs, so PQRS, the value-based modifier, and meaningful use, and rolls them into one single program. This single program contains 4 performance categories: quality, advancing care information, improvement activities, and cost. A clinician's or group practice performance in these 4 categories will determine your performance score and payment rate. I do want to point out that in 2017, we only have to worry about 3 of the 4 categories since costs will not be counted this year. But this means providers will need a way to monitor their performance in those 3 categories under MIPS and identify a method to submit their performance data. NextGen users can do both of these things through the NextGen HQM. So I will go ahead and hand it off to Cindy to go through an overview of the different features and functionality this HQM portal has to offer. Cindy, whenever you're ready.
All right, thank you, Lindsay. Well, let's get started. Now I'm going to try to make this as entertaining as I possibly can, but unfortunately there's just not a lot to do other than tell you how the HQM works and give you an overview. So let's first talk about what is NextGen HQM. The NextGen Health Quality Measures is a clinical data repository used for registry reporting of clinical outcomes and quality measure data within the NextGen system. It extracts patient data from the NextGen report server and allows report generation for performance-based incentive programs. These programs include the ACO, ASC, CPC+, MIPS reporting for ACI Advancing Care Information, Quality, Clinical Practice Improvement Activities, CPIA. As many of you may or may not know, NextGen is also a registry and data submission vendor and can submit data for all 3 MIPS categories in CPC+ directly, so you don't need a third party to intervene as you have had in the past. Now let's talk about the HQM homepage. The homepage appears when you log into the portal. You will see your site name, system messages or alerts, data processing status, and it will tell you whether they're complete, in progress, what the last process date is, or if no data has been processed. It will also show you the latest reports you've ran and your favorite reports. So we're going to take a look at the home page from a screen perspective. If you're a new user and you've never ran any reports, this first page will be blank, so that's not unusual if you've not done anything in the past. Then what you will see, you can have, if you've ran any reports, the latest 8 reports will be displayed on the left-hand side, and you can also assign favorites, and you can have the 8 favorite reports that you can determine and look at. The navigation of the home page, you can look and view job processing statuses, click an existing report to open it. You can rename a report, create a report as a favorite, generate new reports. You can configure your measures, and then you can navigate using tabs in the menu bar for administration, reports, and configuration. The job status is displayed on the home page, and as you can look at it, if you hover over or click on processing complete or in progress, so you'll see the jobs and you'll see whether the processing is complete or they're in progress. And if you hover over that or click on it, it will actually show you the job status in 3 steps: green indicating the step is complete, blue indicating the step is being executed, and white indicates the step has not been started. This panel also displays the date that the latest piece of data was extracted and the number of days for the data delay. Reports pull from a copy of production data. Reflected will be typically 1 day behind the last process date. Because it's coming from the report server, it's using the backup that is being put onto the report server, so it's always going to be 1 day behind. There is also a 14-day delay in pulling data to the report. This allows for completion of encounter data so results are not skewed by getting data before everything has been completed. The configuration above can be edited by requesting a change through your HQM analyst or HQM support. We've worked with practices in the past that really want their data to be much more current, particularly as you're getting close to the end of a reporting period. So if you make those requests, you can get it to be shortened or, in fact, lengthened, but I've never had anyone really want to lengthen it. One thing you want to make sure is that your report server copy of prod is getting refreshed on a daily basis. If the copy of prod is not up to date, HQM will not pick up the current clinical data. So you want to basically monitor that and make sure that things are working as they should. Sometimes, as you know, backups do not go to the report server, and because it's pulling from that area, you want to make sure that that is actually happening on a daily basis. So let's take a look at the quality program reports. The icons on the homepage report toolbar allow users to view all quality program reports ran by a user and sort by older or newer reports. You can search on a report, or you can rerun a report from the homepage. So here's just some sample screenshots of how these look and the icons associated with it. You can rename a report, you can define a report as a favorite, and then you can view the reports with a different evaluation date. Any announcements that are coming in are also going to be displayed on the home page and follow a color code system. If you see a blue icon, it's going to general information deadlines, green product deployment updates, and red is expected downtime for HQM job information. So again, all of these announcements are being presented to you on the home page as well. And just an example of how you can see a sample of the home page, you can see them on a larger size. It tells you welcome the site, the processing complete. There's no process history here. Shows you your latest reports as we discussed, and on the right-hand side, your favorite reports or reports that you have defined as favorite. You can also generate a new report, configure measures, and then your icons and tabs at the top, home, admin, reports, and config. If you determine you need to regenerate reports, initial setup of a program requires the HQM job to process. Once the HQM job completes, reports will be available, and regenerate reports can be used if edits are made to configuration after the initial reports are viewed or created. Only programs that evaluate during normal processing are available for regeneration. Programs become available for request when one of the following conditions is met. If measures are added to a provider, measure periods are modified, locations are modified, if the provider email, NPI 10 are modified or changed, test patients are added or removed, and list descriptions are modified. Your business schedule is modified, changed, and message categories are also modified. The green circle with a check mark indicates complete when the report has been regenerated. Yellow indicates changes to programs that are available for regeneration, and click the looped arrow to regenerate a report where a program changes. So as you can see, the PQRS Registry Individual 2017 was requested on April 5th, and it has a green check, so it's indicated that it has been completed. But the yellow HQM EHR Individual 2017 was modified on April 10th and needs to be regenerated. And then once you've made your selections, you can click at the bottom and indicate to regenerate the report. One of the nice things that has been added in the updated HQM is you can now search for white papers, and I know that we were really excited about this. It may not seem like something, but it's really able, if you have questions, to be able to go out and look. So within the HQM, you can access white papers that provide detailed information about the program measures. The document feature located at the top right of the portal enables the user to perform keyword search of measure white papers. So as you can see up there, you can go, and on the screenshot we provided, it'll show you the description, and then you click the magnifying glass to search, and then once you have the results returned, you can click the measure name to view a description in the white paper, and you can do this all while in the HQM. That was something you had to go out, questions, and now that's all part of it, and it was really a nice feature that has been added.
All right, I can take it from here, Cindy. Now that we know the main features and functionality of the HQM, let's go ahead and look at actually generating a report to track performance and eventually submit data. So to generate a report, you have a few options from the home page that will all basically take you to the same place. You can click the Generate New Report button, click Quality Program Reports from the Reports drop-down menu, or let's say you've never generated a report before. Under the latest reports, the user will see a link that says Start Your First Report. Regardless of the method you choose, you will end up on the Quality Program Reports page, where you will see the select report type and its parameters. To make a selection, you just click on the box. Once an option is chosen, the page actually expands to display the next step. Each selected item will turn green, and it will be followed by a check mark. The user can also click the check mark to select all items in that section, or the X icon to clear all selected items. And once the user has selected all report parameters, Ready to Generate will appear at the bottom of the page. And once you click it, another message will display while the report's actually being processed. Since we now know the very basic workflow for running every report, let's look at the different program reports the HQM offers. One thing to point out here is that quality program reports are based off the programs requested. So if you don't see some of these on this list in your HQM, that's most likely why you haven't requested them. But users can request any of the following report types. We have the ASC aggregate report, CPC summary report, provider patient report, trending summary, practice patient report, and many more. Now, I did go ahead and include these tables from NextGen on the description of each report and the information found in each of them. I'm not going to read through all of these just for the sake of time, but I wanted you to have them when we send a copy of the slide deck out. They really are a great resource. I will, however, highlight a few of the main reports I think apply to the majority of clinicians on this call. So one of those reports that I use most frequently in quality reporting is the summary report. The summary report is used for attestation for the quality and ACI categories under MIPS. This was the report that was used for meaningful use attestation in previous years and will give you the most accurate depiction of how your providers are performing. The summary report does have two versions that contain different column headings, which I went ahead and put side by side here. Again, these are minor differences, but it's important to point out the addition of the initial patient population and exception columns found in the CQM report. Also new this year are the column headings on the ACI report, which we'll actually go over later on. Another report option is the practice summary report, which is used for groups reporting under MIPS. Groups can now report together under all 4 MIPS performance categories, and this report will list measure data for different TINs in one practice or one TIN across multiple practices, which you can see in this example. The measure summary report is a little different because it shows you more than just the performance rate. It also provides a description of the measure. You can see here the measure description for secure electronic messaging and e-prescribing. What also makes it unique is that it shows practice level results as well as provider level results. So I know it's blurred out in the picture, but that very top row of data is practice level performance. And then each subsequent row is actually provider-specific data. However, the denominator count in this report doesn't reflect any exclusions or exemptions like the summary report does, which means it should not be used for CMS attestation. We also have the measured goal report, which compares performance to goals set by the practice administrator role for your HQM. Really, this report allows the user to easily identify if providers have met or have not met measure goals. It's very straightforward and easy to interpret. A lot of providers like to look at this report because they can see if they're meeting measures right away without any time spent trying to interpret the data. And lastly, we have the provider patient report. So I tried to color code and label the information even though we had to block it out. But with this report, we can see the person number, provider information, the measure, if the performance was met or if it was a treatment opportunity, and then the encounter number. The last column displays the encounter numbers because each person number may be associated with multiple relevant encounters, which is actually what we had happen with provider 2 here. A patient actually had 3 encounter numbers, which are the dark blue and darker gray shaded boxes in that last column. So this is a great report to highlight where providers can make improvements and look at specific encounters in the EHR and determine why they didn't meet a measure. So once you determine which report type you're going to run, you will have to select the report parameters. These parameters include the program, evaluation and measure dates, measures, practices, providers, and then even the financials and patient type. If you look on the right side of the page when selecting parameters, you're going to see a series of circles that indicate the number of steps. So a blue circle represents the current step, and green circles represent completed steps. You can actually click a circle to go to that step or hover over it to the name of the step. So just a really good tool to guide you through report creating. Now the first selection after report type is going to be the program. The user will select the program they want the report to be generated for. Now I want to point out reports are run separately for each program, and only one program can be selected at a time. Programs are listed by year in descending order and then alphabetically. A green circle indicates the program is set to be evaluated, whereas a gray circle indicates the program is no longer active. So the user can still run a report with a gray circle, however, just know it's not set to update when the HQM job is being ran. Next are the evaluation date options. The evaluation date is the date that the report will pull data for. So again, only one date can be selected, and the user will want to select the latest evaluation date to see current reporting data. The user can select older evaluation dates or search for dates to see a report with older data. If no evaluation dates available, that means the configuration for the program has not been completed. So just a quick screen grab here. You can see the report, program, and evaluation date options we just went over, as well as that guiding tool on the side to show you your progress. You can also see those programs that have green circles, that mean they are active, and those that have gray circles, which means they are inactive. Next are your measure options. These are the program measures that will be reported on. Available measures are based on the program selected previously in the program filter and measures chosen during configuration. Measures are going to be listed by their number, and they'll have the domain listed underneath. There are also really cool new visual indicators for certain measures. We're going to look at those later on. Now to select a measure, you can click on the check mark. That'll select all measures. This is definitely the easiest option. Or you can click a measure to add that specific measure and unclick it to remove it. You want to make a note here that not all measures are going to be visible, and you most likely will have to click the next page bubble to see the rest. Also note, only the measures you added during configuration will show up in this list. So if you removed a measure you didn't want to report on, you can still select that check all button and it will not appear in the report. Then you have your measure period options. These are the start and end dates for the measure period the user will report on. So measure periods may be adjusted to show data for a full year, quarterly, or any custom 90-day period. And this is actually done when configuring measures. So some very recent news in regards to measure periods. CMS just proposed a rule that would decrease the reporting period required under Medicaid meaningful use to 90 days instead of a full year as originally planned. So this just came out this past week, and we fully expect it to be finalized. So I did want to point that out here. So again, here we can see the evaluation dates, measure period, and the differences between selecting all versus just selecting one measure. Also that next page bubble indicating more measures are listed than just what we're seeing. You may also notice the visual indicators I mentioned. There are specialty-specific indicators in green that show which specialty a measure falls under. There are indicators for high priority and outcome measures, which at least one is required under the quality category, and bonus points are actually given for reporting extra, so it's good to know which measures these are. There's also an indicator for inverse measures where low performance is actually better. And finally, there are Medicaid-only indicators. So Medicaid meaningful use is a separate program from MIPS and still requires reporting of meaningful use measures. The HQM still reports Medicaid reporting. It just uses the same reports as others under MIPS will use for their ACI performance. Just note, a clinician cannot report on any measures that say Medicaid only and receive any credit under MIPS. So definitely some important indicators to keep your eye out for. You can also see if a measure is included for multiple specialties. Just simply hover over it to see which are listed. ACI visual indicators are similar to the CQM or quality indicators, and that there's also a distinction between Medicaid and modified stage 2. MIPS clinicians will just want to choose the modified stage 2 measures. Again, the Medicaid measures will not get you any credit. Same goes for the optional measures. These optional measures may have been previously reported on but are no longer mandatory. And NextGen really just kept them in there in case you wanted to continue tracking performance for your own practice needs. All right, if we get back to the rest of our parameters, after measures, you will see practice options. So these are the practices the user would like to report on. To select a practice for inclusion in a report, you just have to click that check mark to hit Select All, or click an individual practice. Again, you want to note that if you have a lot of practices, they might not all be visible on that first page, and to click that next page bubble. Next, you're going to see provider options. These are the providers the user would like to report on. We already went over how to select them. Providers can be added or removed from this list under the Configuration tab. Keep in mind, under MIPS, users will have to report data for eligible clinicians, which include physicians, PAs, NPs, CRNAs, and CNSs. So this definition from eligible provider to eligible clinician was expanded. And finally, the last step to generating a report is specifying the insurance or payer type. For MIPS reporting, users will select Medicare Part B and non-Medicare Part B when running reports. The default is actually already set to select both for you. Then you'll click Ready to Generate on the bottom of the page to generate the report based off your selected options. Again, just a screenshot to show those last few steps before generating. We can see this specific example only had one practice, but quite a few providers, and then the insurance types, which were automatically defaulted to include both. Now, there is one parameter I didn't mention, and this is because it only appears for two report types, the individual practices report or provider patient report. These patient types show the user treatment opportunities, exclusions, and performance met data. So this is the report I showed earlier with the color blocks. For that screenshot, I selected all three patient types, but you can just select one. So the patient type I run most often is the treatment opportunity report. This is a good report for troubleshooting because it lists the EHR person number that's included in the denominator, but did not meet the measure specifications to count in the numerator. The person number can be entered into the EHR, and you can complete a chart review to determine why they're not meeting a measure. So this is a really big help in identifying possible causes of low performance. So I encourage everyone to run these reports for any measure that is showing a lower performance than expected. Once you do so, look up the person number and encounter number and compare it to the NextGen white papers to see what kind of documentation you could be missing. You can actually start doing this now to make any workflow or documentation changes that would boost your performance. If you're choosing to report for a full year, or maybe even a reporting period later in the year, this could really help you out. Finally, you can see what a successfully generated report would look like. These reports can be exported to be saved and printed. Most of the time when I export it, I use Excel, but there are a lot of options for whatever works best for you. So I know this has been a lot of material so far. It's been a bit dry, but stick with us because I think a crucial part of leveraging your data to see an accurate depiction of your practice's performance is configuring your measures. This process determines what data is pulled into the report and is vital to reporting your best possible data. So I will let Cindy take it from here on the actual configuration process.
All right, thank you, Lindsay. Well, as we move into measure configuration, as Lindsay said, it is the most important part of this because if you don't configure it right, it's not going to function properly. Now users can view and configure measures for providers participating in a program from the menu bar. You just need to click Config and then Measures. And as you can see, it's just a drop-down very similar to the other screens that we have in NextGen as we're moving forward in the past and in the present. On the Measures page, it enables the user to add or make changes to the program that a provider is participating in. Users can add and remove providers. They can add and remove measures for their providers. They can change the reporting periods. These configuration changes are edited and saved by program and by practice, so there's great flexibility there in setting these up. If you take a look at the screenshots that we have, you can make any configuration changes, select a program from the program list. The programs are listed by year in descending order. The programs' names are listed alphabetically for each year. And after a program is selected, you can confirm the practice selection from the drop-down. The practice selection determines which providers will then appear in the reporting that you're going to be moving forward with. The number of measures assigned to each provider will appear in blue with a blue circle, and changes are based on the program selected. So you can pick your program and then your providers, and all of these changes are configured associated with that particular program. If the user clicks on the provider box, a window will pop up showing a list of those assigned measures, the provider's NPI. A green background will mean that it has been verified. The reporting period, which can be auto-configured or customized by clicking the calendar icon. The user can also choose to show or hide measure tags by clicking the check mark found under the calendar icon. In the configuration, you can click the green plus icon, meaning you want to add an icon. Adding Measures page will appear where the user will select the practice, the provider, and the measure that they wish to add. Once they have picked which they want, then they will hit Complete to add those measures that they have selected. Taking a look at this screenshot, as when you go in, it will automatically bring up mandatory measures, and those are going to be displayed with a star beside them. Users can then hover over the measure to display the measure selection. So as you can see on the screenshot that we provided, you'll see the measures that have come up. The mandatory will be selected, and those with a star are automatically put in place for you because they are mandatory. If you want to delete all measures for provider, select the X box below the provider's name, and then the red X when confirmation message appears, and you can go ahead and remove the measures. If you want to delete an individual measure for a provider, select the provider, click the red X next to the measure in the window that appears, and then only the measure that is selected will be removed. So now in terms of, as we're going to bring it home, I'm going to turn this back over to Lindsay, and she will take us through HQM and MIPS reporting now that the configuration has been completed. Try to hang in with us. I know this is dry. I'm sitting here thinking how I would be listening to this, but this is really important stuff, and I can tell you that our experience in the HQM module for this year, it is much better and much improved, and I think you're going to be able to get the information you need out of it easily once you have your configuration. So Lindsay, take it away on the reporting.
Great, thanks. All right, so I think we all know how to generate a report and configure the measures, but we want to look at how the HQM will specifically support the MIPS categories to ensure the success of clinicians in this new program. So if we look at the reports you'll want to start running now to gauge your performance in these categories, there are the ACI Stage 2 objectives and either the CQM or PQRS report for the quality category. And then the CPIA and cost categories will actually not be monitored in the HQM. There won't be any physical reports or data being pulled for those two categories. Notice that I mentioned you'll want to start running these reports now to gauge your performance. Start early. This is not a program that you want to rush to start running your reports and figuring out where things could have gone better at the end of this year. So I mentioned earlier the cost category has a weight of 0 in 2017. We don't need to do any additional reporting or really worry about its impact. Providers will still receive feedback reports. These will be similar to the QRURs providers received in previous years, but again, it will not affect your actual score or payment adjustment this year. And then the CPIA or improvement activities category can be submitted via the HQM, but it's just a simple yes attestation. No data needs to be reported. So for those of you who have reported meaningful use in the past, you were used to clicking yes to running your security risk analysis, and no data was actually reported. You just had to keep proof in case of an audit. This is going to follow kind of that same pathway for the improvement activities category. So we have had a ton of questions on when certain reports would be ready. And in response, NextGen released this HQM Report Roll Out. We can see the CQM and ACI reports are good to go. Also along with that are the CPC measures. However, the PQRS report, notice that it just says PQRS benchmarking. This report will not be ready until spring. So right now the PQRS report is using the 2016 measures against your 2017 data. So you can still run these and get a good idea of what your performance would be like, but just know the PQRS measures that just need updates should be coming out in spring, and then the new measures will actually be added to be determined is what NextGen has said, but hopefully very soon. Now if we look at the ACI summary report, this again is that previous meaningful use report. It will be used to track measure performance for the advancing care information category under MIPS. And that performance percentage you're seeing is actually your numerator data over your denominator minus exclusions or exemptions. So that's crucial because that is the correct data you will want to report. One thing to note is that the performance thresholds have been removed. There's actually no longer a pass-fail methodology for advancing care information. If it's a base measure, clinicians have to get 1 in the numerator. So there are actually 4 base measures, and you're going to see that as the set goal on the report. But in reality, you're really just trying to get as high of a percentage as possible for each of these measures to improve your score. You're going to be compared against your peers. So again, no pass-fail methodology, no certain threshold you have to meet to be safe. It's just trying to get as high as you can. Notice I specified for advancing care information there's no thresholds. There are still thresholds for Medicaid meaningful use reporting. And NextGen has included these on the report. So there's actually an ACI and Medicaid column under the goals heading to adjust for this program separation. So let's look at an example of the report. Again, it does look very similar to previous years. Besides the columns I basically surrounded in red. There are now those 2 goal columns, the one for Medicaid and one for ACI, since again those thresholds are now different for each program, but also the addition of the ACI performance rate column. This column takes a provider's performance rate based off their numerator and denominator data and converts it to the appropriate number of points they would receive toward their category score. So how the scoring works for this category is your percentage is converted to a certain number of points. You're given a category score, which is then weighted into your actual total composite score. So this is automating the process of converting performance rates to points when scoring a provider's ACI category. So this is a really big help in interpreting the data. Providers can come in here and just look at the exact number of points they're receiving. Most of the measures are out of 10 points. So you can see on this example, medication reconciliation, these providers are doing really well, but they have other areas of improvement. One thing I want to point out here, the health information exchange or summary of care, this bottom measure, you can see the goal is still 1 for the ACI, and it's actually in red. This is a base measure, and you have to have 1 in the numerator. So as of right now, this provider would get no credit in the ACI category of MIPS. So just kind of an example of walking through the scoring methodology using the HQM summary reports. Now, before we jump into the quality summary report, let's look at the decisions your clinicians will have to make. The first is pretty obvious. It's going to be between if you're reporting under MIPS or the APM track, and most people have made this decision by now. Now, if you are under the MIPS track and that's where you fall, the next will be if you should report as a group or as an individual. You do have to report this way for all 4 MIPS categories. So let's say you were a practice that actually did group reporting for PQRS in previous years, and then obviously meaningful use reporting was individual for providers. You would need to make that choice. you can no longer mix those reporting mechanisms. It's all or nothing. Then how long you will report for. So we have this pick your pace option where you can either submit something, you can just test your system, you can submit for 90 days, or you can submit for a full year. If you don't submit anything at all, you will automatically see negative payment adjustment. And then finally, which reporting mechanism you will use for the quality category, either EHR or CQMs or registry or PQRS measures. And again, this decision doesn't need to be made right away. You can wait, run both reports, and see what's best for your practice. So you do have the option, since the HQM is both a qualified registry and an EHR. So again, that decision really depends on what will benefit your practice more. And when I say benefit your practice more, I mean you're going to want to choose the report that has your highest performing measures compared to the national benchmarks. So you may perform very high on a certain PQRS measure, but if that benchmark is higher, you may actually choose a CQM measure that you have a lower score on, but it's higher than the benchmark. So really looking at that analysis. I do want to point out you cannot mix submission methods. So again, it's like that group and individual reporting, it's all or nothing. You have to report all 6 measures using the same mechanism. NextGen did actually release a really nice white paper that shows the measure overlaps with PQRS numbers and the corresponding CQM numbers. They also have this really nice indicator legend that will tell you things like if it's a high priority measure, if it's a new measure, that means it may not have a benchmark, or if it's an existing measure with proposed substantial changes. This is important if you find one of these measures that you reported on last year. Your performance may vary. It may have been very good last year. It may not be very high this year because of the changes. So again, a very, very valuable white paper to go ahead and look at. So I always get the question, which one should I pick or which one is better? And I promise you the answer really is it depends on your specific practice. I can't give you a general answer. The measures capture data differently, so there are workflow variances. For instance, PQRS measures tend to be a bit more flexible workflow-wise, whereas CQMs tend to depend more on the codes used and often have multiple denominator requirements. We can also look at the number of measures supported by the HQM that may factor into your decision. So the HQM supports 53 measures with EHR reporting. These are your CQMs. Notice that there are 64 CQMs for Medicaid. So there are about 9 measures that are going to be Medicaid only in this section, are going to have those visual indicators on here. There are 113 measures with registry reporting, or PQRS. And there are 24 total outcome measures, which are required to report 1 under this category. NextGen also supports all 14 CPC Classic and CPC Plus measures and all 15 ACO measures. They also support 22 measure sets and 74 claims measures. Now I mentioned those 22 specialty sets the HQM supports. NextGen not only has the MIPS specialty sets, which you can see on the top half of the screen, but they also added their own just to help clinicians who maybe weren't covered by those specialty sets listed above, so they can choose the appropriate measures for their practice. And you can actually search for these in the HQM. One thing to keep in mind with these specialty measure sets is that if a set has less than 6 measures, you're only responsible for the measures in that set. So we can see the general requirements for the quality category are reporting 6 measures. 1 must be an outcome measure, and if there's no outcome measure, you can choose a high priority measure. So if we look at a urology specialty set as an example, the PQRS set has 11 measures. So you would have to report on 6 of those 11. Whereas the CQM measure set, or specialty set, only has 5 measures total. So you would only have to report all 5 of those and you would not be responsible for finding a sixth. So again, just another factor in that decision between reporting EHR or registry for quality. All right, finally, we can see what a quality summary report actually looks like, and this is a CQM example. Again, the columns are mostly the same compared to prior years. The only major enhancement is the addition of the national benchmark column, which is what you're compared against to get your category score. So this will help in the measure selection process a ton. Last year, we had the summary reports up on one screen and the measure benchmark PDF up on another, trying to hunt for certain measures as we compared every performance rate to the benchmark. So again, this is a major, major improvement NextGen has made. Now to kind of wrap things up here, we can look at how the HQM will actually submit each category. It will generate a QRDA Cat3 file or an XML file for you to actually approve, and then NextGen submits the data to CMS on your behalf. So this process will be very similar for those of you who's ever submitted PQRS or CQM measures via the HQM. The QRDA files will be available at the group and individual provider level. You'll just go under Program Submissions, generate a file. You'll need to look at the file, approve it, and then let NextGen know and they'll submit it. Now, yes, this does mean no more manual attestation. The option is still there from CMS. They have stated they will still have a portal similar to the meaningful use reporting, but it's no longer your only choice. You can submit everything you need to all in one place through the NextGen HQM.
Okay, thank you, Lindsay. I do want to tell you that the work and effort that goes into putting these presentations together, I really want to thank Lindsay for it. My real purpose here is to give her voice a break as she's going through this. She really has the knowledge that we're hoping we can share with each of you, and we will be having other webinars and things coming forward as MACRA continues to move forward. So if you're uncertain where your practice stands, let iTenant help. We can do it by assessing your current readiness, providing recommendations, and implementation of new processes and procedures. We are also offering MACRA packages now. We've got a 3-tiered fixed price MACRA support packages, MACRA Fundamentals, MACRA Intermediate package, and MACRA Expert package. If you're looking for additional information, you can reach out to us. We are also going to be working on a MACRA quick guide that we will be making available to everyone in a future webinar, and we'll let you know as we move forward with our continuing webinars. So next steps, you can visit us at itenant.com. You can sign up for our webinars and blogs. You can consider one of our 3-day fixed price on-site consultations, clinical workflow, revenue cycle, and front office, technology and performance. You can test drive our products, Refund Manager, ChartGuard, and in addition, we're going to be offering a number of boot camps that we'll be adding to our repertoire, and we'll be having a webinar on those in the upcoming future as well. So now let's turn it over to questions to Lindsay and myself. I hope it looks like we have quite a few of those out there. Thank you, everybody.
Thank you, Cindy. Thank you, Lindsay. It does look like we're already getting questions rolling in. And again, you can type your questions in the questions area of the GoToWebinar control panel, which is probably along the right side of your screen. So we're just going to start in the order that we receive them. Do you have any idea when the HQM will enable us to start running reports for 2017?
I can go ahead and grab that one too. They have already started the report, so if you're not seeing them in your HQM, you may just need to reach out to your HQM analyst and have them added to your portal. So the ACI report and the quality reports, the CQM specifically, are available. Again, that PQRS report's available. It's just not going to be the true report. It's used for benchmarking purposes right now. So I would say if you're not seeing them in that portal, go ahead and shoot an email over to HQM support or your analyst and ask them to add in the 2017 reports.
Great, thank you, Lindsay. Next question/comment, I think that somebody was a little confused. I thought that for 2017 there were no performance goals. So if you're referring to the ACI category, you're right. There's no set threshold you have to be above.
The performance goals, those thresholds, are still in place for Medicaid reporting. The only goal that's actually set in stone is for the base measures. There are base measures and performance measures under the advancing care information category. Those base measures, and there are 4 of them, you have to have at least 1 in the numerator or you will not receive credit in the ACI category. So those are the only true thresholds for this program, but we want to keep in mind MACRA, the MIPS program, is budget neutral, so the losers pay the winners. So you're going to be compared to your peers overall, that if you're showing a lower performance, you're going to see a negative payment adjustment. So that's why I say, again, no performance goals, but you're going to want to score as high as you possibly can.
Great, thank you for that clarification. Can we get a copy of the slides? Absolutely, within the next week. I'd probably guess towards the end of this week. We'll be sending out an email to everybody who registered for the webinar that's going to include a link to the recording of the slides, or the recording of the presentation, as well as a link to download the PDF copy of the slides. So keep your eyes out for that. Next question. We added some PQRS measures available in NextGen for 2017 as a group. Some of the measures on that report shows all 0, whereas if I select an individual report on the measure shows up, whereas if I select an individual report, the measure shows up on the report. Do you happen to come across similar scenarios, and what causes it?
I have not heard of this specific scenario recently. If it's the PQRS report, just something to keep in mind, you may want to run the practice summary report instead of the summary report for group reporting. So I would say go ahead and try that first. The next step, again, would just be talking to NextGen or whoever supports you to possibly look if the data is pulling correctly or not. But again, for group reporting, you want to go under that practice summary report versus individual. You're going to just use the regular summary report.
I would agree, because I did hear a couple of times about this last year from some of our direct clients, and it did ultimately involve NextGen. But I would follow Lindsay's steps, and then if you can't, I would reach out to NextGen.
Great, thank you both. The proposed rule for 90 days for Medicaid, is that for performance year 2017 or 2018?
That is for performance year 2017
I'm sorry,
for Medicaid.
Yeah, I'm sorry, Lindsay. Never mind. I jumped in. I was misreading. I was reading ahead on the questions, so sorry.
Nope, you're fine. Actually, and it is 2018 as well. So for 2017, we've really been waiting for this for a while now. Medicaid was supposed to be an entire year. They just came out with it actually earlier this week, actually last Friday. They tucked it in at about a 2,000-page proposed rule. So we are waiting. We're assuming that will be finalized. Also for 2018, I want to point out that it's a 90-day reporting period as well for the advancing care information category. Because of that 2015 EHR certification upgrade that will be required. But yep, 90-day proposed reporting period for 2017. Again, it is not finalized, but we are sure hoping it will be.
And the rumor has it, which is where I was jumping into that, is that in terms of those of you who are planning to go to 5.9 and 8.4, that there may be some light at the end of the tunnel for next year as well, because you will need the 2015 rule, and that's where a lot of individuals think that will also change for 2018.
Okay, thank you both for that. Next question. Eligible providers. You didn't have ODs listed.
Oh, then that is my mistake. I will look at the slide deck. They are included in the eligible clinicians under the physician category.
Awesome. Thank you for pointing that out for us. We'll make that correction. Next question. ACI, is there a specific setup to get the numbers in? My report returns most zeros.
It's not any specific setup. If you have that ACI Stage 2 2017 report loaded into your HQM and it's showing mostly zeros, you may want to look at the reporting period you have configured. If it's showing just a certain 90 days from last year, or if it's set for a full year for this year, I would say check there first. Otherwise, again, possibly that could be some type of configuration error. You may want to reach out to NextGen. You can also go under the configuration tab through that measures and look to make sure all your providers are added and that they're showing up and all the correct measures are added. That may help as well.
Okay, and it looks like a slight follow-up to that. Also, if we are reporting as a group, do we exclude part-time providers that we did exclude last year, or should we include all for the group reporting?
If you're reporting group, I believe it would include all providers, but we can also follow up on that definitely because that's a special circumstance.
Perfect. Give me just a second. I'll mark that one down for follow-up. Okay, next question. If a provider is a specialist and there is a specialist, I'm sorry, let me start over. If a provider is a specialist and there is a specialty set available, do I have to choose measures from that set, or can I choose any measures?
You do not have to choose measures from that specialty set, and nor do you have to report that specialty set. You can choose any measures. I know a lot of people, instead of actually reporting the specialty set, because you can search in the HQM by specialty, they're just adding those measures to see their performance and then picking and choosing other measures that they can report on as well. So you're definitely not restricted by specialty. It's really just there as a tool to kind of help you out and find measures that apply to your scope of practice.
Great, thank you, Lindsay. Next question. Will the PQRS reports get the national benchmarks added to the quality program report like the CQMs?
Yes, and I believe they are already in there, and if they're not, they will be rolled out with that PQRS spring report. Should be coming soon, hopefully. Great,
thanks. Do you know if that will be exclusions for ACIs like last year? Example, less than 100 referrals, you can take an exclusion on health exchange information for 2016.
Unfortunately, there will be no exclusions for this year. So that summary report, that ACI summary report that I showed you, where if you noticed, their denominator was also 0. Usually in previous years, you could be able to exclude from that and it wouldn't count against you. This year, you cannot. That's why there are no thresholds besides that 1 in the numerator. So unfortunately, no more exclusions. You just want to perform as high as you can.
Great, thank you for that, Lindsay. And it looks like this may be our last question, but we'll hang around for a minute or two if people are still typing questions and answer those. And if any occur to you later, you see Cindy and Lindsay's information up there. Feel free to reach out to them or reply back to the email that I send out later this week that'll have a link to the slides and recording. Get a hold of us on social media. Basically, any way you can find us, let us know what you're thinking about if you have questions, and we're happy to help. So last question. Do the PQRS reports need to include Medicare and non-Medicare, or just Medicare like previous years?
So I was actually just on a NextGen webinar where we went ahead and went over this too. You do MIPS quality reporting reports on all payers. So you would report on Medicare and non-Medicare Part B when running that report. Right now, if you're running the reports, it's the old PQRS report. It's those 2016 measures with your 2017 data. So it may automatically be showing up or selecting just Medicare, but definitely something to look at as well and keep in mind.
Great, thanks. And it looks like another question rolled up. If there are no exclusions for the base measures, what if a provider doesn't have any prescriptions?
Again, CMS is assuming that you could have at least a minimum of 1 in the numerator. So I haven't heard of any special considerations if you have a 0 over 0, that it genuinely does not apply to you. Again, I haven't heard of any exclusions for this just because they lowered the threshold so much, and these measures are not new and they've been around.
Okay, well, thank you. Lindsay, Cindy, do either of you have anything to add before we finish up for today?
Yeah, just thank you everyone for joining us, and we look forward to seeing you on a future webinar.
Yes, thank you everyone.
Perfect. Thank you everyone for joining us today, and I hope to see you next week at our next webinar. Have a great day.